Books, backpack, and paint. What a combination for a topic tonight. You know, this is probably one of those things that most of us adults have, we don't even think about. We've sort of forgotten about. And yet, it's so real to so many Americans that as we send our children off to school, well, this is what's in store for them. To start to engage with the books, have to carry their backpacks, and ultimately experience that pain because they've never been set up properly. You know, here at the Limerick Chiropractic Center, one of the big reasons why we have these conversations and we do what we do is because of our why. Without reservation, to provide and protect for those entrusted with love. See, by having these conversations and providing this information, the hope is that we get to protect. We get to protect that next generation. Those individuals who, you know what, they don't have any level of awareness of the scope and the depth of what they're doing to themselves. And this is why as parents, as adults, I ask you from hello to make sure that you're doing your part. To like this video, to leave a comment, and also share. Share this amongst your Facebook friends. Because here's the thing. As we settle into this conversation tonight, and for the next 20, 25 minutes, we're going to talk about these backpacks and how it is that we're going to be helping our children, how it is that we're going to be making sure that, we're protecting them. In these next 20 minutes, we can either make this all about ourselves and just say, hey, listen, that was really great information. Yeah, I'm so glad that you shared it. Or we could do the uncomfortable thing, which is to help somebody else. See, sadly, I recognize most of our chiropractic patients, they're 50 years of age. They've had a lifetime of worth of use and abuse. They've had a lifetime of building up problems. And yes, the very first subluxations, the very first time that the bones come out of place is oftentimes with the birthing process. 4,000 impacts by the time that we're 4 years of age have occurred. And yet the insults keeps happening. Because we go to school. And for 12 years, we're carrying around books, we're carrying around iPads, we're carrying around devices. We stick them in our backpack. We use this thing like it's a piece of equipment that has no effect on us whatsoever. And we wonder why our children develop problems. I want you to look at this picture. This picture should be that clue of what's happening right in front of us. And now, as parents, is exactly the time to pause, to make sure that we're doing our part by understanding some of the gravity of what is going to be occurring, and take action. Now, before we're finished tonight, listen, I'm going to give you that opportunity of making sure that you're taking action, because I recognize that it's not just about you doing your part, but by us doing our part to make sure that our children have the opportunity of just simply getting checked. I don't care whether they're chiropractic patients or not. These backpacks are carried around by our children of numerous ages, and unfortunately, either it's going to build them up, make their body stronger, or more than likely it's going to continue to create problems and break them down and become worse and worse and worse. Take a look at this. You tell me. When you look at those pictures on either side of that individual in the center, doesn't look very balanced, does it? When we look at this individual here, you see that that backpack being slung over the one shoulder. Well, that's not very balanced. If you talk to anybody who's been in the Boy Scouts, anybody who's been in the military, they're taught how to pack a backpack to make sure that it's balanced properly, to make sure it's slung properly, so that you're capable of going long distances without feeling the ill effects of carrying 20, 40, 60, 80 pounds of product on your back. Likewise, if it's not balanced properly, if it's too heavy for you, if it's not positioned properly, then you get to look like this young man here, you know, where unfortunately he's starting to lean forward, and we recognize that posture. We see people walking around. In fact, you see those older individuals that are walking around more and more hunched over. That doesn't happen overnight. You wonder where that starts? It starts from here. See, this is that ideal. In the center, we want to see that things are balanced. We want to see that that backpack is in the right position so it has a minimal effect on the body. It's set up properly in order to make sure that our body is capable of holding it in that best position for as long as possible without creating strain. Now, there are some things that you need to know. And in fact, this is so very important that, you know, we need to make sure that, well, we understand one size does not fit all. Listen, I love the fact that we can walk through the store and we can see so many of these backpacks. And I see kids all the time. The backpack is bigger than the kid. The backpack is twice the size of a kid. And the parent says, well, listen, I have to be able to put these folders in there. I have to be able to put these different devices in there. The sad thing is that it doesn't matter. If it's too big for your child, it's too big for your child. You know, when we look at these guidelines, we recognize that in the end, you know, the backpack should never be wider than the child's shoulders. It should also not be any longer than their torso. And yeah, the lower that backpack goes, let me just tell you, the more weight, the more pressure, the more stress is not only put on the shoulders, but also on that low back. And innately, the body just knows, hey, listen, if you start adding weight to me, I'm not going to walk around leaning back like this. I'm going to counter weight. I'm going to counter that weight, and I'm going to start to lean forward. See, the problem is that oftentimes, you know, parents, listen, when was the last time you picked up your child's backpack? I don't care how old they are. I don't care whether they're 6 years old or whether they're 17. Pick it up. Feel it. You're going to recognize the fact that, you know, they got an awful lot of stuff in there. And let me give you a clue. The bigger the backpack, the more stuff you want to shove in there. The more stuff that gets left in there. Why should I bother taking it out? I can just carry it around all day with me because, listen, it's really tough to stop at my locker during the course of the day. So it's just easier for me to chug everything with me. Oh yeah, by the way, you know, because we can, you know, we have these nice thermoses, we have these nice water bottles that we can stick in the backpack and, well, let's do this. 1 gallon of water, 1 gallon, 8 pounds of weight. Now in a minute, you're going to be given the formula to figure out, well, you know, how much should this backpack actually weigh? How much can be loaded up in there? And this is not a chiropractic thing. This is one of those biomechanical processes that everybody accepts. And everybody understands that it's a guideline for the best outcome, the best results. So when we look at that, 10 to 15% of your child's body weight. Now let me give you a clue. That includes your backpack. So yes, it's only a pound or two, but guess what? That's still, for Johnny, who happens to only be 50 pounds, well, already that's taken up a good bit of the weight that he could actually put into that backpack. As we get older, it doesn't get better. As we get older, we get to bring bigger, heavier books. And let's not kid ourselves. Things like our cell phones, things like our, the tablets, the laptops, all of those add to the weight that's in our backpack. if you're like my daughters, for a while they had to carry around their gym clothes on those gym days. For a while, because they didn't have access to their lockers, they had to also carry their lunch on their backpacks. Oh, this thing of weight becomes an issue when you start adding up all of those things that your child has to walk around with. See, and the sad thing is that unfortunately, like I said, kids oftentimes don't clean up messes. I mean, if you've ever had a 10-year-old or a 16-year-old and you go into the room, you sort of figure it out real quickly. You know, they don't like picking up anything they don't have to. They don't want to clean up anything, including they don't want to have to clean up their backpack. It's like, really? Why is this thing in here? You know, do you really need it? The answer is no, but it's just left in there day after day after day. See, parents, we need to be aware of what's being left in there because we recognize that our child's not going to necessarily make those best choices. You know, sort of like in how we actually wear these things. You know, unfortunately, if we're not only making sure that they're properly weighted but also properly positioned, it's going to be a problem. Now, I know there's this really cool thing. You just let that backpack hang all the way down as low as it can go. Love that look. It's awesome. It's one of those easiest ways to set up our child for distress in their spine. The backpack should be raised up as high as it's supposed to be. It's really, the weight is supposed to be up into the chest area as far as the back is concerned. It's not supposed to be resting all the way down on the hips. There's this little thing that's called gravity. It's a law of nature. We could argue about it if you want, but you know, law means that it's going to happen every time. And you know, unfortunately, as we take our backpacks and put them into that position where they're hanging lower and lower and lower, it wants to pull us back more and more and more. Now, unfortunately, you know, we want to make sure that as we look at these backpacks, it's evenly balanced. Now, fortunately, most backpacks do have straps that you're capable of pulling down to ensure that those straps are balanced from side to side. For some parents, let me tell you, those single sling across the shoulder backpacks, not necessarily the best choice. We could talk about all the different postural problems that come from having, you know, that excess stress pushing down on just one side, just one shoulder. I mean, no offense, but you would never go ahead and carry, you know, 10 pounds of weight just on one side or hoist it onto one shoulder and not do anything on the other side. But that's what we're doing when we have a backpack like that. Likewise, you know, as we have those roller backpacks, I love that. You know, my child doesn't have to carry it, they just pull it behind. Oh, I'm sorry. This twisted position looks really great as far as balance is concerned. And if you're like most kids, well, you know, most kids mess with each other in school. So how long before you figure that somebody is going to either, you know, yank on their backpack or they're going to get caught on something? Which means their body is going forward and all of a sudden they're twisting around. Not the better choice. You know, when we start talking about books and backpacks and pain, listen, you know, we have to look beyond what you and I probably grew up with. The typical way of learning. We would just, you know, bring home all of our study books. Well, now everything is coming home a lot of times on a Chromebook or on an iPad, which means we have to make sure that ergonomically we're setting up our children for success in regards to how it is that they're going to do this work that they call studying and homework. And here's the thing, you know, sadly, they need to be able to replicate this even in school. So you're going to see these two pictures up here, and this is exactly what, you know, during the pandemic I went through with my daughters. Ergonomically putting them into that best possible position. Because when that laptop is just simply on the desk and they're having to hunch forward in order to actually look at that Chromebook or look at that laptop, guess what? they are patterning their body into this really bad position. And we wonder why our children have this thing called anterior head carry, or they've lost the curve in their neck. We should be, like you see on that far side, we should be having that material raised up so that the top of it is at eye level, so that the child is able to look straight ahead, so that it reduces stress, not just off the neck, but the mid-back also, and allows for them to have that better way of learning. Because this is pretty similar to when you put a cell phone in your hand, all right? Same thing. We want to make sure that we're not hunching over, that we're looking more straight ahead. In fact, I'm going to correct this because you've heard me talk about this before. Listen, this is still not okay. That's not a good position. We want to make sure that we're raising that phone up so that it's at eye level with us in order to make sure that we're gazing straight ahead. And let's not kid ourselves. Our children have access to these devices 24/7. Most school districts in our area, unfortunately, they use an iPhone, they use a phone, they're going to use an iPad as a hall pass. Yeah, if they want to go to the bathroom, they have to take this thing with them. The sad thing is that they're connected to it all day long. And in fact, if you did not have the opportunity of watching the video that we produced last week on electromagnetic forces, you need to go back, you need to watch that in order to help to understand some of the effects that that technology is going to be having on your children and how it actually weakens them. So, one of the things we want to make sure of to ensure that our children are set up for success is to make sure that we're consistent with their bedtime. Sleeping 8 hours or more is absolutely essential as the body is growing that rapidly. And you know what? If your child's not getting enough sleep, unfortunately the body and the brain can't function as well as supposed to. And it's not about just the hours of sleep, it's about the right position. If you're a stomach sleeper, if you walk into your kid's room and you see them on their stomach, stop it immediately. It's easier to change a habit at that young age than when you're 40, 50 years of age. This isn't me. You could look it up online. The worst possible position is sleeping on your stomach. Yeah, we would rather you on your back or on your side, and there are good and better ways of setting you up in order to have this done. And for your child, listen, it's a matter of setting them up for success. Sometimes half the battle is just making sure they're in the right pillow, which helps them get into that right position. In the end, that proper sleep, that restful sleep allows the body to rejuvenate even more quickly so that they're actually ready to re-engage in school the very next day. So the question is as simple as this information sounds, who are you going to share this with? You know, I recognize we could make this all about us, or we can make this about helping that next generation, helping our children function better and easier. Now, I told you point blank, we were going to do something special, and listen, for the next week here in the office, if you send us a note, go ahead and in the comment section, ask us for a backpack check. We're going to make sure that the kids are getting checked. In fact, to me, it's one of those things, whether you're a chiropractic patient or not, I don't care. Our children need to get checked. They need to be prepared for the school year and be prepared properly. Now, I'm going to tell you how simple this is. We do 3 postural pictures with our children. Number 1, their normal posture from the front and the side. Number 2, with them wearing their backpack as they would normally wear that backpack. Number 3 is going to be with us correcting how they're utilizing this backpack. So we get to see their normal posture, how it's being affected by the backpack, and then how we're capable of improving the stress on their body by ensuring that they're wearing it properly. If you would like your child checked, do me a favor, make sure in the comment section below that you notify the office of a backpack check. I'm Dr. Joseph Baker from the Limerick Chiropractic Center.